Hey, it's Ala, and I'm reporting from the San Diego County News Center on an article titled County Reports Second Locally Acquired Dengue Case. And it describes the second case of locally acquired dengue in San Diego County and the response from public health officials in San Diego County. The first case was earlier this month. This is significant because dengue is a tropical viral disease that is not commonly found in the United States. It is transmitted through mosquitoes who bite an infected person and then bite another person. And while that mosquito was noted in San Diego County back in 2014, there have been no reported cases of locally acquired dengue until now. There have been cases of travel-related dengue in San Diego County, meaning that those individuals likely traveled somewhere where dengue is common and came back to San Diego County where they started experiencing symptoms. And of those types of cases, there have been 49 in the calendar year from January to now in October. Regionally, there have been 5 cases of locally acquired dengue in Los Angeles County, which are our neighbors slightly north of us. And dengue fevers can be relatively vague, so they include things like fever, chills, aches and pains, and vomiting. However, they can be more severe and progress to shock and respiratory distress. Perhaps most significantly, there isn't any antivirals that are used or specific treatments for dengue. It's just supportive care. And in the case of the individual that the article reports on, cases can be severe, leading to hospitalization. In the United States, a dengue vaccine is recommended for use in children. However, the caveat is that they either had previous dengue infection or are living in areas where dengue is common, so that really limits that pool of individuals who are recommended to be vaccinated. The article details a relatively aggressive response from the San Diego Public Health Department. So it states that there were flyers left on doors in the area of Escondido where this person was suspected to acquire dengue, and the flyers showed a map of the area as well as details regarding the response, which is spraying pesticides around the area from backpacks on foot and from trucks. So they started spraying this past weekend. They sprayed about 170 different homes, and the map showed the area that they were spraying in and the specific dates that the public health workers would be spraying the pesticides. The article has some considerations regarding the region being sprayed and states that the droplets of the pesticide dissipate within 30 minutes, so it's relatively short acting. It recommends keeping windows closed, turning off fans that draw in air from the outside, keeping pets indoors, covering fish ponds, and cleaning homegrown fruits and vegetables. Hopefully people are already doing that before eating them, and washing skin and clothing with soap and water. Again, I hope people are already doing that generally. This article was particularly interesting to me because I work in a veterinary hospital about 15 minutes away from the area being sprayed. And the article has a link to the particular pesticide called Aqua Duet. And the safety data sheet says that it's a pyrethroid, so it's a synthetic pyrethrin, so it's specific to insects. And I care because if people call our hospital and are wondering if their pet is affected by the spraying, I can tell them with relative confidence based on this article and the safety data sheet that unless their pet was lapping up this pesticide, this is not the reason why they're sick. So dengue fever can be identified through blood testing. I assume that this only occurred because this person was hospitalized, so the true number of people infected with dengue in the area is probably higher. And that's all I've got on this particular article. In the newspaper regarding public health, they also talk about a health survey of the Tijuana River. The Tijuana River starts in Mexico and crosses the border into California. Currently, there's been a breakdown of the sewage treatment facility on the Mexico side of the border. And this has been affecting San Diego, southern South San Diego County, along the areas of the Tijuana River and the river outflow into the ocean for a number of years. It sounds like this health survey is giving a little bit more voice to the public to voice their concerns and specific symptoms that they have experienced that they believe are associated with the Tijuana River pollution. Those symptoms include vomiting, diarrhea, and suffering from the terrible odor. So hopefully this public health survey, which is a collaboration between the CDC and local San Diego Public Health Department, will lead to some sort of interventions. And that's all I have for you guys today. Thank you so much for listening.